Most of the sagittal plane motion that occurs in the human neck, that is flexion and extension, occurs through the C5 and the C6 motion segment. When the C5 and the C6 degenerates, even more flexion and more extension occurs through those segments. Many clinicians don't fully understand the cervical disc. And they don't understand that the cervical disc is about 3 millimeters thick anteriorly. It's only 1 millimeter thick posteriorly. So the axis of movement for most all cervical motions, and particularly flexion and extension, occurs right over the anterior aspect of a cervical disc, which means that the posterior portion of the cervical motion segments move a great deal. The axis points in front, so the back portion of the segment moves the most. We don't need to prescribe large amplitude flexion and extension to sufficiently move the C4, the C5, and the C6 motion segments. In addition, large amplitude flexion can cause compression of the spinal cord over osteophytic formation at the joints of von Luschka, and large amplitude extension causes central canal closure and closure of the intervertebral foramen. Our patients don't need any of that to occur if they have degenerative changes in their neck. So how do we keep the C4, the C5, and the C6 segments safe during the prescription of therapeutic self-stretching or self-mobilizing in the sagittal plane? Again, we use the therapeutic stretch-out strap or the patient's leather belt. We have the patient place that belt around the C3 or the C4 bilateral lamina, pull forward, and then bring their chin down and in. This will sufficiently stretch posterior soft tissues in the neck. Remember, the disc is only 1 millimeter thick. It's not very strong. We don't need to place excessive tensile loading through the posterior annulus. This will sufficiently move the neck into extension and at the same time prevent closure of the central canal and of the intervertebral foramen at those three key levels, C4, C5, and C6.